All this is Dr. Mobeen Sayed from Drbeen.com. Welcome to one more show. Let us start our discussion for today with some stats, reviews, and news, and then we'll start doing our questions and answers as well. So get your question and answers ready. So let's do it. So first of all, this is Drbeen.com. Then here, Liza, who is actually here on the discussion as well, she's a cool bean. She sent me this tweet. Creator of Sputnik 5 says Brazil injection is due to US pressure. I think, Brazil rejection. That is a rejection of Sputnik 5 vaccine is rejected. So Brazil rejects Russia's Sputnik 5 COVID-19 vaccine, citing uncertain data. So that is what is happening. I have actually thought that the data was a little sparse, other than whatever they had already published in the form of their own summary. So maybe there is that data somewhere which I am missing. But this is an interesting thing. I think at this time, if US is doing it, US should not do this. Anyone who can get hold of some vaccine that can help is useful. That is useful. So here is another news. So this news is basically Pfizer CEO is saying that they would have a pill by the end of this year. So this is also sent by one of the cool beans, Karan Veer. So this is saying that Pfizer CEO is saying that we'll have a pill by the end of this year that will cure or help with the COVID by the end of this at home. So I want to quickly see that what word did he use? To treat COVID could be ready by the end of 2021. So they use the word treat. I think these guys are allowed to use the word treat. Other drugs are not allowed to. This is a list of all the approved therapies or tests or other things by FDA. There was some discussion while we were talking at Dr. Bream discussion yesterday. And in that, it was interesting to see what are the things that have been approved or have been given emergency use authorization, not approved. So here is a list just to get us on the same page. This is a propofol. This is to maintain sedation via continuous infusion. Bamlanivimab for the treatment of mild to moderate COVID-19 in adults, and it is actually an outpatient drug. And I think that we all are aware, we have done this discussion, that Bamlanivimab, when they approved it, they actually approved it on the basis of phase 2 trial. What did they do in this? What they did was they had, I think, about 500-ish people, 592 or something, and they divided them into 4 groups. One was placebo, and the other 3 groups were various doses. So dose 1, dose 2, dose 3 of the same drug. And this is actually a phase 2 trial where you're trying to figure out which dose works better. And then I think 28 milligram was the one that was compared to placebo, and they said it reduces the or it does some improvement, which is not really significant either. So this was phase 2, and based on this phase 2, they had said, good, we are approving it. Consider other drugs that are in phase 3, or the drugs, for example, leronlimab, that have better potential. They are not approved, and here there is a phase 2 drug approved without a phase 3 to say, go ahead. Then this is Regeneron. We know this, and Regeneron is something that I really love. Remember when Trump became sick with COVID, he was given Regeneron, and how fast he recovered and came back. So Regeneron is very important. And please remember, in the US at least, because Regeneron has been given EUA, one can ask for it if they are ill. I think it is not a standard practice, but one can ask that, hey, if they are in hospital, they can say, I need Regeneron. Baricitinib is another combination, and it is in combination with remdesivir. I remember that baricitinib was something that was said to improve the situation or the hospitalization by one day if given with remdesivir, which was a weird thing, but this is also given EUA. Convalescent plasma EUA. Then Regiosit to be used as a replacement solution only in adult patients treated with continuous renal replacement, so kidney help. And then Fresnium, then is the Remdesivir. Remdesivir we've seen has not shown any results. And so WHO has actually said that stop using it, if at all WHO is of any use to talk about. And then Fresnium once again. So these are the emergency used approval authorizations, use approval. And many folks put this comment there that, hey, they're not going to approve anything because if they approve it, then there is no justification for vaccines. I understand that. But still, within the list of EUA, this is the list we have. All right, so now let's quickly look at some of the numbers as well. So here is Israel's cases, and let's see what are the latest there. So rolling average 122, I think this is one of the lowest. And if I just go and try to, I can't even, so after 315 here, I cannot even place my mouse over something that would respond. So last data I have is 22, and I don't have data afterwards. And I shared it yesterday that they said, I think yesterday or day before yesterday, they only had 30 cases. Active cases 1653. I think they are not offering more case data because there actually is not much to offer. So very few deaths as well. I hope that these go away too. So this is Israel. Very good job on their end. India. So India, I think, is still in a lots of risk and stress. Many of the cool beans, both in India and Pakistan, I think in this whole process, we are kind of ignoring Pakistan. I think Pakistan is also going through a similar situation. My doctor friends over there, some of my other friends over there, they are saying that people are on ventilators or the people are hospitalized. So it looks like both nations have this issue. So here we have India. Of course, India's population is very large. So the numbers are very large as well. And I would continue to say this, even if there is a remedy right now that can be built, let's say vaccines can be built, they cannot be given to everyone within a short period of time. So the solution has to start with locking down, stopping, restricting the movements, reducing the contact, and then figuring out how to get back out. This is a similar thing like UK, which did an aggressive lockdown near Christmas and then controlled it. And during that time, the vaccination continued as well. And now UK is in a much better situation. I totally understand that locking down a population of 1.34 billion people is a difficult logistical issue. UK. So once again, I have been impressed with how UK has done. First thing that they did very interesting was separated out the doses, so increased the duration between the doses. That was interesting. And here, look at this. They did the lockdowns as well, and now they are down to this 2,600. At their peak, they had 59,000 cases per day. So from there to come down to 2,600, almost 20 times lesser. So that is very, very good. Active cases, 79,000. After their tiny first wave or the hint of the infection, the minimum was 36,000. So they're still double than the lower point they had after the first wave. But they are doing very well. And if you see here, number of deaths have gone down, way down as well. So good job on UK side as well. Peru. So somebody was saying that Peru is the next disaster that is about to happen. So here is Peru, and weird thing, they just continue to move with a high number of cases. I think 30 million people's population. And here they are. Active cases are going up again, but not a very big spike yet. And here is the number of deaths. The spike in the terms of active cases. The spike in terms of new cases is definitely, there is a third spike, which is continuing. So this is there was one more interesting thing, and that was um, the India's additional issue. I think this would be the case for all countries as well, is the domestic violence. So as people are locking down, as they're home, as they're stressed out, as I'm sure that financials are ruined, then there are folks who are experiencing domestic violence as well. So it's not a good situation. This is the cool. So this is where we are from a news point of view. Tell me, how are things here? What are the questions? So I'm gonna see there is a question here. P King, have you heard about the new variant in Sri Lanka? It can last in airborne over an hour and is highly infectious. So the no, I have not. But what is going to be strange for me is to accept that it can be in the air. It can be airborne for more than an hour because it is a new variant. If a virus is sitting, so just from this part of the news, it looks like an incorrect news. Uh, we know this, that if a virus is sitting in a droplet, so let's say this is the virus sitting in a droplet, and droplet, I've done this discussion before, size is larger, and then that droplet falls to the ground very fast. So that is why the distance it cover is lesser, because it is heavier. But if this droplet continues to shrink, then, and it becomes aerosol, aerosol, then it can stay here for 2 to 3 hours. So this is a known thing. It is not the virus's property to fly. Virus will not get its wings to start flying. It is the property of the moisture that is keeping it up. So the moisture in the environment, the droplet size, the aerosol size, all of those would decide how long the droplet would stay up, or the virus would continue to float in its boat in the environment. Now, the highly infectious part is something that can be understood, that most of the variants are becoming more infectious because they are creating changes on their spike proteins that are getting selected. So, but I'll look it up. Okay, what are the other questions? So why per they're using ivermectin? Diane, I did not understand the question. So Amitha SJ says, how many doses of ivermectin should you take for prophylaxis? Is once a week enough, or do we continue every week or month? So let me explain how various doctors have been using it. The Egyptian and Indian studies, in those studies, the prophylaxis was for 1 month. So let's say this is 1 month. They had given it on day 1, similar thing, and then day 3, and that's it for the whole month. That's it. And then they tested after a month, and they had the efficacy of about 74%. So this was one study, or some studies like this. FLCCC says that take it on day 1, then day 3. I think my hands and my vocal cords are not broken in yet. Day 3, and then every bi-weekly, every 14 days, for example, every 2 weeks. So day 1, day 3, then 2 weeks, and keep going in this manner. So that is FLCCC. I have the protocol of, and this has been like this from ever. I give it day 1, then day 7, then day 14. So I am just very simply weekly. No day 1, day 3, just weekly. Maybe there is an issue with my protocol to not do the loading dose, but this has been working fine as well. So here are 2 or 3 possibilities. If you wanted to go with the evidence-based decision, then this is the one, and that would mean that you continue to repeat it. They stopped the trial here because they wanted to measure the results at the end of the month. But if you wanted to continue this, then do the same thing again next month, day 1, day 3, and nothing for the whole month and continue. Rahul says, why Novavax is not approved? I think that it will be approved. They just have to put their data up and request for the approval. So they are in that process. Terj Shuma says, one small study showed that messenger RNA vaccine did not create memory cells in elderly. Can it be overall problem with the messenger RNA vaccines? Possible. It could be dose related as well. And if you think about it, this is an issue with the Johnson & Johnson as well. So let me show you a data point from Johnson & Johnson. Let me just open it up. So this is Johnson & Johnson's FDA briefing. In this briefing, they have shown the efficacy. So look at this. This is document name is, so that if you wanted to see it, VRB PAC 022621 meeting briefing document. And I'm going to just look at this page number so I can come back to it, 29. And if I go to the title of the page, this is the Vaccine and Related Biological Product Advisory Committee meeting, FDA briefing document, Janssen AD26CoV2S. So this is Johnson & Johnson. So if I go back to 26th page now, 29th page. So we are almost there. So here, look at this one, table 13. Vaccine efficacy of the first occurrence of moderate to severe critical COVID-19, including non-centrally confirmed cases, with onset at least 14 or at least 28 days. So what are they saying? They're saying that we are going to report here in that table the data for moderate or severe illness that started, let's say, 14 days after the dose or 28 days after the dose. So here, 14 days, 28 days. And what you'll see in that table that I'm going to show you, so this is the dose, that here the efficacy is better, and here the efficacy will drop and drop below the FDA's set watermark. So look at this. This is greater than 60 years of age, folks. And if you look at the title over here, onset at least 14 days. So at the 14 days between the cases in the vaccinated and others, the efficacy was 64.9%, which is fine. Not great, but fine. But at 28 days, the efficacy actually is only 42.3%, if you can see here. 15 cases in the vaccinated and 26 cases in the non-vaccinated. So total capability was 42.3%. That is Johnson & Johnson. So Terj, to answer your question, here we have an adenovirus-based drug vaccine, which is, excuse me, 1 second. We have an adenovirus-based vaccine, which is not showing great capability with efficacy in older folks. So going back to your question, if messenger RNA are not creating memory cells, there are two answers to this. One answer is that we have already seen that in some people, the predominant pathway is T helper 1 pathway, which is cytotoxic T cell pathway. And most of these folks would respond to this infection without much symptoms. And that is possible. And that can happen with vaccine as well. If that is the case, there will be less memory B cells, there will be less antibodies produced, but they would still be able to have a robust response. The other possibility is that maybe the dose is not sufficient or vaccine is not efficacious enough that it can cause the memory B cells or trigger the immune system to produce memory B cells. So all these possibilities are there. Karen says, question, is it possible to test for previous COVID-19 infection more than a year later? Yes. So that T-spot test, which FDA has approved, T-spot. So T-spot folks had sent me an email that I have incorrectly cited the company name, or they thought I collated the company name with some other test as well. So I asked them to tell me which part to edit, and secondly, if I can have their CEO with us and talk with them as well. So let's see if they respond. So, but there is a T-spot test that looks at the T cells in us, and that can actually tell if we were infected for many months before, even a year before. So that is one way. Other way could be to look at memory B cells, which is very similar to the T-spot test. So this is fine. This test does not exist, but if this was there, this would have been the same way. Saying that antibodies should be there, they may not be there, because if they are there, they would be in a very low quantity. So yes, it is possible. A different era says, question, I have been curious about transmission between animals and humans. We may be overlooking a critical part of the research. What if your daily interaction with animal has been a major driver? Maybe. It came from the animals before, it is going from humans to animal, then it would come back. We have seen mink issues. In the US, we saw those issues as well. So maybe that is the case. The way a different era to move forward in this kind of hypothesis is to actually find some studies or do some studies. Heather says, Dr. Bean, can you Google vitamin D blood clots, please? Okay. Vitamin D blood clots. So this study is 2014, so an older study. Vitamin D has been shown to have an anticoagulant effect. A decrease in 25-hydroxyvitamin D concentration has also been associated with an increased risk of venous thromboembolism. Hence, we sought to determine the relationship. The result was the participants' mean age was 47 years. Baseline characteristic was not significantly different. The concentration of vitamin D was significantly lower in the deep vein thrombosis group compared to the control group. Very interesting. The prevalence of participants with deficient vitamin D levels was significantly higher in both DVT and control group, and they have a p-value which is significant than those with the sufficient vitamin D levels. So 68% versus 13%, and p-value is significant as well. In multivariate analysis, vitamin D level and sex were found to be the only independent predictors of DVT. So gender and the vitamin D. Very interesting. Conclusion, low levels of 25-hydroxy-D are associated with idiopathic lower extremity DVT. Further investigation is needed. So that was an older one. So let's say 2014. Did anyone bite this concept and did it again? So here, emerging role of vitamin D and its associated molecules in pathway related to pathogenesis of thrombosis. This is a more recent study, 2019. And I just want to quickly look at the results. It can occur in either in the arterial or the venous system, resulting in many severe complications, including myocardial infarction, stroke, ischemia, and venous embolism. Vitamin D directly or indirectly controls the expression of several genes responsible for the regulation of cellular proliferation, differentiation, apoptosis, and angiogenesis. All of those are the process of potential relevance to thrombotic disorder. This review thus discusses the effect of vitamin D on pathway. So let me just see if they have a conclusion somewhere, or if their discussion is longer. So antithrombotic actions of vitamin D. So it helps protect against thrombosis. So very good. Thank you, Heather, for this very, very useful Googling. P-Mine AI. Question, FLCCC has up dose of Fibrometrine and added fluvoxamine. What is the evidence of favor for fluvoxamine? Is it a game changer, and what stage of COVID? So we know that there is one study about fluvoxamine, and I was part of these discussions as well. I'm still part of these discussions. I have to provide some input back today as well. So yes, fluvoxamine has a study that shows its results. Then fluvoxamine usage, for example, Dr. Heather says that since he has been using fluvoxamine with ivermectin, he has not seen any patient going to hospital. And I have requested Dr. Heather to come join us as well for an interview. So it seems like there is data and there is evidence for this. There is more to come. So I would explain in a couple of days as I provide my input as well. So section 1 says, could help us identify the inhalation product that the FLCC has recommended. So give me about a day, and let me provide my inputs for some of the choices, plus they're working on the long haul with me as well. So give me today and tomorrow that I have to do my part of the homework. Once I provided my feedback and they have updated it further, then I would do a talk about it as well. Aditya Chipa says, I have been taking zinc acetate for zinc from last 10 days, but today maybe it felt like it caused some stomach pain. In what others form I can take zinc, which might not have? So I'm not an expert on the zinc forms. Aditya will have to look it up and kind of figure out the other one. Remho says, ivermectin was produced in India, but they still have chaotic situation. Is it possible ivermectin was not effective or India was not on an ivermectin believer? So I think that India, there are some states, for example, we keep talking about Uttar Pradesh, that they were using ivermectin, and because of that, they were actually doing better compared to, for example, let's say Maharashtra, which was not using ivermectin and they were not doing as good. And I have done those talks a little bit before as well. Even in today's discussion, if you would see that I have left some links about these. So let's kind of very quickly see. So we have a team member or a participant for ivermectin discussion who was participant in the conference over this last weekend. He has been collecting data for ivermectin usage and doing statistical analysis on that. He was working on India. I'm going to reach out to them and see if they have collected enough data that we can use that and have a discussion. But here if you see, this is India. And if we go here and look at Maharashtra, for example, if you click on this, there is show more data. And here are the active cases. They are declining now, which is good. Recovered are improving. There are deaths as well, and active cases are going down. If I go back now to, so Maharashtra, confirmed cases 44,000, active 4.4 million. So the comma usage is slightly different from, so 4.4 million, active cases are about 600,000, so less than a million. Then here are recovered, tested 2.6 crore. Crore is crore is 10 raised to power 7. So 6 is million. So 10 million is 1 crore. And if we see, that is Maharashtra. And if you see Uttar Pradesh, I had done an analysis of the percentages of the cases, and Uttar Pradesh was almost half or lower. And it is said that Uttar Pradesh is the one that is using ivermectin. I have to collect the latest data. So if you see here, active cases went up and they are now kind of, we'll see if they are becoming sloped horizontally or they would start going down. But in terms of percentages, that is something that will be interesting. Kerala is higher up as well. I do not know if Kerala is using it or not, the ivermectin. So to answer your question, there are some areas in India that are using ivermectin, other are not. My own experience with the cool beans or with my friends over there, team members, many do not know about ivermectin at all. even when so my team members, they said when we talk with our doctors, they say, what is ivermectin? My own team members who are doctors who have been working with my lectures are not aware of the ivermectin's usage and significance, which kind of made me sad. Louis Somsak says, what will happen if the already vaccinated with inactivated vaccine candidate receives the booster with an mRNA vaccine? It would be good. So I have done this discussion in the past as well. The only difference is the dosage. But what would happen is this. So let's say somebody takes Sinovac. Sinovac is an inactivated virus, right? So this is Sinovac. I wanted to make this virus inactivated. So here, an inactivated virus really simply means that their RNA has been attacked by some sort of a chemical agent, which would make the RNA broken and kind of tied up. And now this virus is a virus. It is a SARS-CoV-2, but this virus actually cannot do anything. So when they inject that into our body, what would happen is the immune system will become active and the B cells will become active. And these B cells will make antibodies against many parts of the virus. So they would make antibodies for here, antibodies for here, and so on. This virus is 29,000 or more base pairs. And then if you divide them by 7, that is the number of epitopes or patterns on the virus that may be used. And there are some epitopes that are overlapping. For example, if I make 7 here, 1, 2, 3, 4, 5, 6, 7, and then I make another 7. So let's say 1, 2, 3, 4, 5, 6, 7. It is not necessary that an epitope, which is a pattern or an area that is identified by an antibody, it is not necessary that antibody would now choose out of these 14. There will be 2 antibodies produced, one for one pattern and the other for other pattern. You could actually have antibody overlapping as well. So there could be, let's say from here, 1, 2, 3, 4, 5, 6, 7, and you could have an antibody against this pattern as well. And then you could have, let's say 1, 2, 3, 4, 5, 6, 7, and there could be an antibody for this as well. So as you can tell, that patterns could actually have overlapping antibody production as well. Plus, patterns or epitopes could have skipped antibodies as well. There could be a pattern here, 1, 2, 3, 4, 5, 6, 7, and there is no antibody for this area at all. Or there is no antibody for this, or there's no antibody for this. So that can also be possible. So now the question to your question, that once we have the virus, inactivated virus, and we have generated a tons of antibodies against a spike protein, matrix protein, its lipids, its N proteins, and so on, then you give another vaccine, which is, let's say, messenger RNA. That means it is a spike protein vaccine. So let's say here is the spike protein. And now the body is aware of attacking everything, including the spike protein. So those B cells that are present and that are kind of sleeping, so when they would see that the spike protein is there, they would connect with that and they would immediately become ready and they'll proliferate and they'll start making antibodies. So it would act as a booster for sure. The question is about the dosage and should the doses are sufficient as well or not. But yes, it can be taken as a booster. ET says, would you expect any side effects of one mRNA vaccine to also occur with the other, since they are the same concept, any probably same ingredients and probably the same ingredient? Not concerned about mild but moderate severe. So good question. And the question is, what caused the side effect? If, for example, if we look at it, Moderna versus Pfizer. Pfizer has deep cold storage, right? Ultra cold chain needed. That means that their lipid nanoparticle is not very, very stable. And their messenger RNA the nanoparticle can break very easily, versus the nanoparticle here, which they say is very, very stable. and it doesn't break that easily at even higher temperatures. So this can stay in a little more warm than compared to this one. That means that even when we say that they both are nanoparticles, they still are different in their compositions. So if they're different in their compositions, then what is it that is causing the side effects would have to be seen. If it is just the messenger RNA that is producing the spike protein, even then there can be a difference. The reason for that is, for example, let's say you are a company and I am a company, and we both have the spike protein genome in front of us. So let's say this is the genome for the whole of the spike protein. Let's say it is about 7,000 amino acids or base pairs. I decided to make spike protein out of this by using, let's say, this part. I'm just conjecturing. I do not know exactly which part they use or all of it or not. And you decided to use this much of a part. That means our spike proteins could be different. And maybe there is some antibody produced because of this part here, which may cause an issue. For example, in case of adenovirus vaccines, we know that, for example, what is that, Johnson & Johnson or AstraZeneca or Sputnik, they would have adenovirus in there, and that may be the adenovirus that is doing it. So here, the difference in the genetic material chosen and the antibody is triggered, or the difference in the kind of composition, that may still be keeping them as two different kind of vaccines in terms of side effects. Generally, their side effects should be similar, but composition can be different. And we have a proof of composition being different just by looking at their need for cold storage. Excuse me. Jax L says, this looked promising. Excuse me. So we have cleaners who are working, and they sprinkle those acids everywhere to start cleaning up, and that gives me this cough. So this looked promising. Positive impact of oral hydroxychloroquine and povidone iodine throat spray for COVID-19 prophylaxis and open label randomized trial. Excellent. So we'll look into that. Thank you for sharing. Spot the Bengal says, oh, so there is a Bengal there. Question, FLCCC now shows prophylaxis with ivermectin is weekly. So wow, so they have taken similar approach as mine. Where is Lufecam? So Lufecam is not started yet. I'm going to see if I can put that over here. I'll put that up. I think I'll have to switch to OBS Studio. OBS Studio is a relay or broadcast system as well, where you could bring in multiple cameras and multiple sources and then use them. And Luffy just went by. Hey, Luffy. So we can, maybe I'll have to switch to OBS as well and then do this. So Fruyandiasis or vanilla bean. Question, the zinc surely makes a huge difference. My best friend, morbidly obese, from first sign, she took high dose of zinc. She went fine. Hubby, not obese, caught COVID, but without zinc, he went poorly. Yes, so zinc with quercetin would make a lots of difference. So thank you for the anecdote. So the Shitij Ragnakar says, have you heard anything about Virafin and its efficacy? So yes, we discussed Virafin as well. I am just looking for some more data. So I know that they have become approved as well. Anubhav Das says, what are your thoughts on the use of mRNA for cancer? What's the potential, and could it be potential cure? Uh, in my opinion, what would happen is that the mRNA vaccine, that is what Moderna was actually trying to do. mRNA vaccines will become, you can say, designer um, mRNA targeted for cancer cells. So, for example, let's say this is somebody's cancer cell, person A, and there is another person and their cancer cell, person B. And let's say this cancer cell, the person A's cancer cell, has some specific surface proteins that it is exhibiting. Some surface proteins. And please remember that cancer cells, because they have become non-compliant cells, they're rogue cells. They can have various surface proteins removed from the surface, and they can add various surface proteins as well. And here is another person's cancer cell, and let's say they have this surface protein added to their system, so to their cell surface. So if we can take the cancer cell out and we can kind of figure out what patterns are they showing, then we can send a messenger RNA, just like now we are doing for COVID. That messenger RNA can make antibodies that can attack any cell showing this specific pattern. Or in this case, we can make another mRNA that can attack any cell that is showing this one. So in theory, what will happen is that they would have labs throughout. So let's say this is a country. They will have labs throughout the country. In those labs, somebody who has cancer, they would come in and they would say, you know what, please take my cancer cells and see what is unique about them and make me a messenger RNA structure that would help my immune system build antibodies that would attack that structure. And ideally, a normal immune system cell would also, our normal immune system is also supposed to attack these, but it has failed to do it. That is why cancer cell stays a cancer cell and continues to grow. So they'll make this messenger RNA that can then be injected into that person. So this is kind of a designer solution on the cancer. So it can be a cure, but it is going to be one by one. So then can this technology then continue to evolve to say, can we figure out certain epitopes in cancer cells that are always unique or always present for a certain cancer type? And then can we make messenger RNAs against those? Or could we create, for example, let's say messenger RNA-based vaccine that when injected would protect from the, let's say, breast cancer? And how would that protect in the future? That we have already trained the immune system, just like we're doing with SARS-CoV-2, and we know that breast cancer cells have a specific pattern on them. And then we have already taught our immune system to attack any cell which has that pattern. So now here, let's say there is one tiny one cell. Cancer always starts usually with one cell. So let's say there is this one cell in the breast tissue. We just showed that pattern that we have already showed to the immune system. And if that happens, immune system is already trained because we vaccinated the person, and that immune system would attack this cell and immediately destroy it before this cell becomes too prevalent and does something bad. So Anubhav, to answer your question, it's not really a cure as a global big cure that one shot cures all cancers. Instead, it is a vaccination that can protect from, for example, lung cancers or breast cancers or more prevalent cancer types, or if a person has a cancer, then specifically address that one cancer. And in that possibility, it could be curative. Drbeen from Chicago. Laureen, am I correct that you are from Chicago, right? Because I've been reading Drbeen from Chicago before. Question: if one vaccine could act as a booster to another, would taking the vaccine after having the recovering from COVID act as a booster too? Is that a reason to be vaccinated after the disease? So here is the good question. So in theory, the answer is yes. The question I'll ask you in return, somebody got infected with the actual monster infection, recovered from it, their body was able to handle it. Why do they need a booster? What will the booster help them with? But if we go with the mainstream thinking, the doctors, the CDCs, they say yes, even if you had the vaccine infection, take the vaccine afterwards. And for example, in Israel, they are giving vaccine 90 days after. And then there was a study as well that showed that, hey, if given vaccine after the infection, first dose ramps up the production of antibodies. And we have done that discussion. And then the second dose doesn't do a lot of difference. So my conclusion from that was, fine, one more dose can be interesting. But generally, if somebody has gotten the infection and recovered, in my opinion, they do not need a vaccine. But that is my opinion. Mainstream says give vaccine. So let's do a couple of more questions. Liza says, could geneticists just take the cancer variants from our DNAs or from tube babies? So the could take the cancer variants. So there are certain cancer modifications that are standard, and there are certain that are not standard. The reason a cancer cell, and I think we should do this discussion as well, that how a cancer cell works. So I was reading Nick's comment. So just one quick second. So could take the cancer variants from our DNAs or from tube babies? So I want to keep that question in my mind. Nick says Dr. T. Colin Campbell, PhD, showed in China study that most non-hereditary cancers were related linearly to consumption of animal proteins. So that is one of the possibility. And I want to go back to Liza's question. So Liza, if I'm trying to interpret your question, could take the cancer variant? Do you mean by this that the change in the cancer? There are certain cancers in which we know what kind of gene expression will become different and what kind of surface proteins may be possible. So these may be that we can create vaccines against those after looking at their genetic patterns. Most of the time, the cancer cells create changes in themselves that are in a certain direction, but what is the exact structure of the surface proteins or the changes is not very similar in everyone. So I hope I answered your question. I caught the question and answer correctly. Salman Tahir says, what is your thoughts on CanSino vaccine trial vector-based vaccine? It's a viral vector-based vaccine. So same thing that the if it is adenovirus-based, which I believe it is in combination with Canada. I have done a discussion. I think CanSino I have not done a discussion. I've done Sinopharm. So it would have a similar possibility, and that is the clotting. Other than that, what I've seen is that they say side effects are less. Now, I do not know exactly if they are really less or it is just rumors. I haven't gotten the data, but my friends have had Sinopharm's Sinovac, and they have been very happy, and their results have been very good. CanSino, I understand, and we've talked about it as well. It is an adenovirus-based vaccine. I do not have the efficacy data. So how about one more question, and then I take a break for my next meeting. Margaret says, thank you, Dr. Bean and World Aside Beans. Thank you very much, Margaret. Hope you're doing better. Let's see. One more question. Colin Hamill. Is it true that silicone implants help against breast cancer since they attract more white cells as they are foreign objects? Maybe. I'll have to research this one because it seems like an interesting mechanism. Hemi, I'll have to look it up. So let's do this. Let's take a break for now. That gives me a chance to get ready for my next meeting as well. Please stay safe, happy and healthy. Keep yourself relaxed and do some exercises. We're almost there in majority of the countries. Let's continue to pay our attention to India, see if we can offer any advice there as well. With this, please like, subscribe, and share. And if you would like to support this work, there are links in the description to buy me coffee or become a patron or support this work in general. Thank you very much. And I would see you, some of you this evening and others tomorrow. Bye-bye.